and find the reason why our sisters and brothers go outside there and do the same work.
Government has no budget allocation for these, sectors, which is really important. Health is a critical sector. So what is the problem then? Why can't they get things like that fixed?
They cannot trust the government. Because what if 2026 is here tomorrow and then they say, okay, let's move it to 2028?
Someone who retired 5, 10, 15 years ago, he doesn't even know the new style of syringe. He's even going to kill people the more.
That's what I'm saying. DLS Wave, and we are back
again.
Right. So today I got a question for you guys. I mean, thank you guys for following, subscribing, leaving comments. Those who do, those who don't, let us know your thoughts about everything we talk about. So I have one question on my mind today. I mean, if you get a job, let's say you're a graduate, you somebody who had a job and lost the job, and then you find a new job. Okay, I mean, it's very common that you expect your employer to give you all the necessary tools you need for you to be able to execute the job to the best of your ability. I think it's very, very basic and nothing to really kind of like even dig into, because this is just common sense. But apparently where we come from in Ghana, everything is just backwards, because this problem has been going on for years. Nurses keep addressing it. They keep, bringing their grievances to the government, but it seems it goes nowhere. So, yep. We are here again, another year, same problem, nurses going on strike, but it's not smart, it's not intellectual to say nurses play a very, very important role in society. So their services cannot be compromised. They cannot go on strike. All right, guys. So yeah, as we said, we don't want to sugarcoat. We don't want to try to make it sound like the government is going through a hardship or it's an economical thing. This problem has been pending almost every single year. We have this problem in Ghana. So yet again, nurses going on strike. What do you say, guys? Over to you.
Well, I don't know. I just feel like, although we don't want to go too political, I do understand that nurses or health workers need better conditions of service, whatever that means, right? But at the same time, I also want us to look at why someone becomes a nurse in the first place, right? I think there are some professions that kind of like, think of it, if the electricity company says they're going on strike, or water company says they're going on strike, or farmers say they're going on strike, what's going to happen to any country, right? It's just the same thing. There are just some essential public services that should not go on strike. I think that they could actually be working whilst negotiating. But on the flip side, our government, I will talk about Ghana government, doesn't really, the only message they hear is when people stop their services. And that's really unfortunate. But all the same, I still think that there are some essential public services that should never go on strike. And if there are any issues to be ironed out, they should be done while they're still working. Because we're talking about human lives here, right? Without humans, there's no country. And if there are no people, nothing else goes on, right? So the humans need to be saved first. They need to be taken care of first. So that's just my initial general opinion.
Yeah, I kind of feel your vibe, but don't you also think it's like every time you compromise, you don't think it's an incentive for the government to kind of like, relegate its responsibilities? It's like, okay, we're going to compromise because our jobs are important. All right, cool. We got to keep doing what we're doing because, patients are dying. We got to keep doing what we're doing because this is really, really important. We're talking about human health, human lives. So it's like, when does the government feel like, okay, we're responsible, we got to get this done as soon as possible? Because let's not forget, this is an agreement that they had, right? Okay, let me read you something to kind of give more context to the whole thing. So one, it says, the Ministry of Health has appealed to retired nurses. Now, this is what they're doing. They're actually appealing. They're not actually addressing the issue. Retired nurses and midwives across the country to volunteer their services. Do you understand what's going on? So it's like the nurses that are on strike, okay, let's pause, let's try to figure this out. But retired nurses, midwives, can you guys, volunteer services? This is not bad to ask of the retired nurses, but you got to really understand that you might not know who's been out of the game for what period of time. Do you know what I mean? Somebody might have retired 10 years ago. They might not necessarily be in tune with what, current, equipment and stuff in the hospitals, because things get upgraded
Yeah.
almost, either annually or whatever. So even though it's not a bad ask, it still doesn't really solve the problem because you're gonna bring in people volunteering, and you don't really know who's got the right, skill set or the right, capacity to do what you're asking them to do. Mr. S, what do you think?
I I quite remember we had a conversation, and I told you, Ghana in particular, things related to government, we love to go in circles, I find it extremely difficult to understand. Listen, every job and its requirements, right? You sign contract because you know you feel you can do the job and you are qualified
Yeah.
to do so. And I want to state this. Nurses, their core responsibility, one of their core responsibility is patient evaluation, right? Take care of patients. So I find it very difficult because if you have to put a human side to it. I understand their frustration. Maybe
Yep.
they are being underpaid and the a whole lot things needs to be done properly in the hospital as in equipment and everything. I get that. But when you're on strike, right? For let's say a 10% increase of salary, which you are due, right? But during that period, lives are being lost. So what you sign on for, what you went to school to do, you are neglecting it. And that is where I have a problem. And it's difficult. I get it. It is difficult to actually separate the two because they need to be paid well and they will do their job well. But the question here is that why is it that other countries you don't hear stuff like this? Why is it that this same sisters and brothers we have in the nursing field, when they travel abroad with all the requirements and with all the demands, they still zip it and go about their job? Why? So if we can find the reason why our sisters and brothers go outside there and do the same work with a higher working hours, right? But they are okay with it. Why can't a government sit and pick ideas from those other countries and add it to ours and then get our sisters and our brothers working? Because now we are talking with this strike, a lot of people have lost their lives already.
Okay, so I think you made some good points, but then again, I would like to make the argument that at the end of the day, I mean there are strikes. I feel like other countries also do have strike nurses strike and all, but I think it's not over those basic necessities that they need for their jobs to be done really well. Because what the nurses are trying to say or the point they're trying to prove is this. Let me read this to you. The strike is being led by the Ghana Registered Nurses and Midwives Association, GRNMA, due to the government failure to implement the 2024, not 25, 2024 collective agreement, which includes issues like allowances, we've known this, incentives, and improved working conditions. Now, is this really something too much to ask? Your
In my
allowances, your
listen,
incentives, yeah, and
in my
improved working
presentation,
conditions.
there's nothing. I'm saying they have every right to demand stuff to improve on their work and also salary wise, it will improve on their lives. They have every right to do so. But that is why I said it is tricky because yes, they can do so without refusing to take care of patients.
But I always like to play the devil's advocate. I'm not saying what they're doing is the best, but we cannot really, I don't know, guess or try to, think about how many times they've tried to engage the government for these problems to get fixed. So I feel like they always try to get it solved behind closed doors until it gets to a point they're like, okay, you know what I mean? We just gotta go all
Yeah,
in. Otherwise,
they
they're not
down
gonna listen
tools and
to
then
us. Yeah, they're not gonna take us seriously. You
here
know,
is
like
my argument. My argument here is that I still stand. They have every right to demand for what they think they deserve. And then the hospital, the equipment, we always complain about those things. So it's equally fine. And government need to meet them some way, somehow, right? But my point here is lives are being lost. Leo gave a typical example. Okay, do you know the number of ECG workers that have not been paid? Or do you know the struggle they go through? The equipment. Look at fire service. Look at how mockery we make of the fire service. Look at their trucks and stuff. Imagine all these people say, okay, we are going on strike. Right?
I mean,
And
they
there's
could
fire
if they
here.
wanted to. My point that I'm
Okay,
making
so
is,
so
okay,
so
think about
so
it.
no, but the thing is, then we should be
Hold
careful.
on, let
No,
me
no, we
let
should
me
be
make
careful.
it.
No.
Okay.
Hold on, let me finish. Let me finish my point. We should be careful because if we have to use strike for every single thing, what would the country be?
You got a point. I totally agree, but my point that I'm making is like this is an agreement that they had between themselves and the government for 2020. Hold on. But now the government has proposed delaying the implementation of these conditions until 2026. Now, first and foremost, let me break something down to you. We've all known conditions of these hospitals where these nurses, these nurses are literally breaking their backs just to get their jobs done. We know, pregnant women giving birth on the floor, right? Of the hospitals. We've seen huge gapes, leakages of water pouring into hospitals. Like, it's really appalling. So I got a question for you. Are patients paying the bills they're supposed to pay, right? Is the government including all these sectors in their budget? So if yes to both these questions, then what's the problem then? Patients pay their bills. Government has no budget allocation for these, sectors, which is really important. Health is a critical sector. So what is the problem then? Why can't they get things like that fixed? Why should it come to a point that the nurses would go on strike?
You know the answer to it, but I'll answer the question with an answer. The simple answer or the simple question to you is that do you agree that our system in some way is broken?
I totally disagree.
Okay. If you disagree,
I agree to a point.
okay,
We're not
okay,
talking
okay.
about the entire system. We're talking about one particular sector.
Yes, I'm talking
we
about
hear
that sector.
Monies, we hear
you.
about monies being
Thank
blown
you.
up. We hear about all these, grants, IMF, whatever, right? And the nurses are not asking for too much.
Exactly. So the question here is people that have been put in those positions that they've misused funds, they need to come answer, because I don't understand how in this modern age, right? Nurses, yes, they have a lot. They need a lot in the hospitals and everything. But you talked about it. Look at our hospitals, right? Let's put that one aside. Why is it that we cannot find a simple solution? But because we know they are important.
Yeah.
That is my point. They are important. That's why I said it is very difficult. But I'm trying to flip the thing and look at it from the human side thing. Like, okay, Charlie, we know, say, you guys, they need the money. You were expecting it this year. They are changing it to next year. I know, you see, but we've created a culture where they cannot trust government because it was 2024.
I got you.
Hold on. It was 2024. Hold on. It was 2024. Now they are trying to move it to 2026. So even if I try to lambast the nurses, everything government is doing is showing that they cannot trust the government. Because what if 2026 is here tomorrow and then they say, okay, let's move it to 2028?
Exactly. So another thing I wanted to kind of bring up is, I mean, think about it. The government is trying so hard to bring in retired nurses and midwives. They're not actually kind of even putting a lot of pressure on these nurses to go back to work. So that shows you that what the government is actually guilty of what the people are trying to, accuse them of neglecting them. Because you would be like, do you remember that video we saw from Lee Kuan Yew, right? Mr. L, remember that video? When the pilots in Singapore went on strike, what did he do? He put his foot sternly on the ground and be like, everybody got to go back to work, where he's going to fire all of them and bring in foreign workers to take their positions, because he knew what he was paying them, whatever they were doing was not that bad, right? But in this case, the government is trying to appeal to volunteers who are, people already retired, to come and do the jobs. So it shows that the government is at fault somewhere. Now, let me give you a little bit of a
Yeah.
backstory, and then Mr. L can take
Mm-hmm.
it from there, right?
Mm-hmm.
Since 2020, Mr. S, 2020, at least there were 9 strikes by nurses. 2020, at least minimum 9 strikes.
Mm-hmm.
2021, at least. Can you guess how many strikes? 2021,
It will go up,
14
or even,
strikes.
yes,
14 strikes. 2022, can you guess?
definitely up,
16 strikes. 2023,
definitely up.
31. 31 strikes. 2024, at least 14 strikes. And now, 2025, there's been at least 6. Right? Some are tiny, some do not really make it to the public domain. So, I mean, think about it. It's something that's been ongoing for a long time. So, how long are these nurses going to keep crying for help? Mr. L.
Well, let me start by saying that I think I would cut this current administration some slack because this agreement was signed, this collaborative agreement was agreed on during the previous government's administration. And the excuse the current government is giving is they didn't include it in their budgets because they didn't do the negotiation. And so if they include that that expense in this year's financing, it's going to derail the economy. So that's why they are saying they want to delay till next year. But yeah, coming back to the whole conundrum of strikes and all that, I think that there are certain sectors of, let me just use Ghana or any country for that matter.
Oh, I think it's universal, yeah. Certain sectors,
Yeah,
yeah.
there are certain sectors that are non-compromisable. Education,
Non-negotiable.
non-negotiable. Education, health, let me just keep it to education and health. I mean, a healthy
I
body
think
is a healthy
transportation will
nation.
be a third one. Transportation pretty crucial as well. The movement of
Exactly.
goods and people, yeah.
And services, exactly.
Yeah.
Now, there are about maybe 5 or 6 sectors that, even in the budget, when you look at the budget, these areas usually carry the most, they usually receive the most funding. But I think that the funding to these sectors is still not enough. You know what I mean? I mean, we can even add like sanitation, right? We still have a country where people are getting malaria in 2025. People are dying from like dust related
So,
illnesses. These things, these sort of little illnesses that culminate into bigger sicknesses should be a thing of the past. They shouldn't even be part of our health system. You know that doctors waste time treating people of malaria and dust related illnesses. So the problems are enormous. But I think a good starting point is conditions of service. They've been talking about conditions of service for nurses for so long, whatever it means. Is it that they don't have syringes, or is it that the chairs you're sitting on are too hard? All these
So
things
everything. You know
affect your.
that beddings, everything.
Exactly. You're a nurse, you're even walking in the ward. There's no even space to even walk peacefully. All these things are, how do you call it? They weigh on your mind and
mental.
your mentality. And so I believe these are some of the things they talk about when they talk about, it's not just about salary and all that. My problem is why, after all these statistics you have given, so many years of strike after strike after strike, why can't we just find a system that solves these problems and say, okay, we have a central store which is always stocked with furniture for hospitals. When a hospital is in need, we quickly supply it. We make sure that we have 4 or 5 containers of syringes all the time in store so that once a hospital is running out, we deliver. You know what I mean? You don't go to a hospital in China and they will tell you we don't have syringes. It will never happen because they always have in stock. We heard a few months ago that containers, even health, I mean, equipment at the harbor, even government cannot clear. Have you ever heard that before? Equipment that are supposed to be used to cater for. So if the government comes back and say that, oh, we didn't budget for it and all, it's not something you have to budget for. This is something that has to be constant. Things that are meant for hospitals and for better working conditions, we cannot compromise. They must always be available. So I
Yep.
think
All
that,
right. Mm-hmm.
yeah, it's not right for them to go on strike, but I think that the government should also satisfy their end of the bargain because it's not negotiable. This is health we're
Yeah,
talking
I
about.
think right or wrong is not really the point here. My question, like you rightfully said, right? They claim they did not budget or put that sort of funding in the whatever. They're
But
planning
there's a
on what it
problem.
was.
There's a
But
problem.
the
Now it's
point
a
is,
problem.
no, just give me
Find
a
a
second.
solution.
When the ex-government was leaving or was being like, it was transitioning or whatever, giving or handing over the stuff or everything to this
Mm-hmm.
new government, did they not know that?
Mm-hmm.
Was that not handed over to them?
Yeah.
Listen. Let's
Right? No, no,
even
no. We
let's
gotta
even
understand. You
pretend.
said it was with the previous government, but they
No,
handed everything over to you guys.
let's
So
just
when you
pretend.
when you're planning for your budget,
No, but
you should
hold
put
on.
that. You
Let's
should
just
put
pretend
that.
it's an oversight. Listen. Let's just pretend it's an oversight. They they did saw it, but they overlook it. Right. Right now, there is a problem. There is a problem. It's a problem. People are dying in the hospitals. Nurses are not working. How do you solve it? Let's
How you
not
solve
stop
it is
going.
you appeal to retired people to come back to work. That's what they're doing.
That is, we
Yeah.
keep going in
So.
circles. We can talk all
Exactly.
about.
And this
Look
thing
at.
you just talked about, that they receive handing over notes. I mean, if I am in a position where I'm taking over from someone and they've handed over some sort of a deal that they signed, but they can't execute it because you're leaving, I will be proactive about it because I know this thing
Because as you
repairs. So what do you
mentioned, this
do?
sector is not a sector to be played with.
Exactly.
You
Exactly.
can't put it
You
in the
don't wait
backseat.
for the strike to happen. Right from the beginning, you go and renegotiate with them and say, okay, this wasn't signed by us, but we would like to beforehand inform you that we would like to renegotiate and give it more time. It's just like our maintenance culture, right? We're not proactive. We wait for things to happen, then we start scrambling for solutions. The health minister has been at post for what, 4 months? Why did he wait till now for a strike to happen before they go and appeal to retired nurses? Someone who retired 5, 10, 15 years ago, he doesn't even know the new style of syringe. He's even going to kill people the more.
That's what I'm saying. But this is the solution.
That's
So
that's
guys, let's wrap it up. I feel like we're gonna keep going on and on because this is one of the things that
Yeah.
you can really get emotional about because, like we say, it's about people's lives. When you're okay, you feel 100%. You don't really feel what people are going through. But there are people
Yeah.
in pain, people who need medicine, people who need being taken care
people
of.
are dying.
It's not
People
a
are
joke.
dying. That's my thing. That is why I try to use. That is why I try to use the human face, and I'm trying to, let's appeal to them, and then they will. But the problem is you cannot look at the number of strikes that you've mentioned, and keep going back.
Yeah. But the
The
thing is,
more
like,
the-
this is one of the reasons why I'm kind of like, back in the nurses stuff. These nurses are seriously one of the most compassionate people on earth. You know what I mean? So I don't think they would just, just take it for granted and just go on strike just for the sake of it. I felt there's been a push for something really, really important to aid them in, executing their work to the best of their abilities, and they're not getting it. So they're
Yeah.
like, okay. I feel like
No.
it's a protest that would probably benefit the guys who actually dying and need that help. It's not for
To-
themselves to be
to
honest.
some extent, we've created a culture where the system like to take advantage of, especially government, of their workers. And when you try to vent out a little bit, people will say, "Oh, but yeah, I get it." That is why I try to put a human face. People are dying and stuff, but they need those things. So I don't understand why you come into government 4 months, like Leo mentioned, and then now you are telling us, okay, we need retired nurses to come to replace the new ones. For what? After a week, 2 weeks, after a month, they will start demanding for stuff because things are not working properly in the hospital.
Yeah, because it's not a joke, man. Let's not.
You understand? So we keep going in circles for the same thing.
Sector.
We keep going. Just sit down and tell them, okay, we will give you this. We can start with this, and then let them go back to work. Come on.
Anyways,
Go
let's
and
wrap it
see
up.
them.
Guys, over to you guys. Mr. I know that's what I'm saying.
Anyway.
It's very easy to get carried away, get emotional about these kind of things because it's not a joke and it's not new. That's the most ridiculous thing. So, guys, over to you guys. Do you guys think the government was right in saying volunteers, retired people will come out of retirement, try to help us, in the short term, or do you think again, as Mr. L said, it's one of those things about just being proactive before the thing happens, and the government is just being lazy as usual? Let's know your thoughts in the comment section. DLS out.